Dr. Robert Waters, and this morning I'd like to talk to you about metabolic syndrome. We have many patients that come into our office with this syndrome, and basically consists of 3 of 5 findings, and that is a person is overweight, they have high blood sugar, they have elevated cholesterol with a low HDL cholesterol, they have high triglyceride fats, and they have high blood pressure. Now, this syndrome, or sometimes called prediabetes or diabetes, is in fact not a disease at all. And I'll give you an example. A gentleman in his mid-50s came to me with a variety of complaints, including the parameters of metabolic syndrome, as well as brain fog, fatigue, pain all over his body, and quite honestly, morbidly obese. When he first came here, he was a little skeptical about what we were doing, but because he was desperate, basically, he went on the diet that we recommend, and we obtained a variety of lab tests. He had findings including diabetes out of control, a very low level of zinc in his body, his adrenal glands were very weak, and they are very important in our ability to withstand stress and heal tissues. He was extremely low in magnesium inside his red blood cells, and that is the compartment of our body that's most reflective of our magnesium status. Magnesium being a metal that activates 80% of all of the enzymes in our body. In addition, this gentleman was highly overloaded with iron. His serum ferritin was 750, a parameter that should be more like 50 or 75, which meant that he had 10 times more iron than he needed. Now, all of these findings lead to the complications of diabetes mellitus, and that is vascular complications, obstruction of the arteries of the heart, cerebral arteries, and arteries of the lower extremities. In addition, these patients develop complications of kidney failure eventually, and eye diseases, retinal disease, and neurological problems, numbness, tingling, and loss of sensation in the lower extremities. So, this patient was more than willing to get started, or rather, after we discussed it with him, was more than willing, and he went on the diet. He came back in 4 weeks, very shocked that he had not only felt a lot better, had lost 15 pounds, and when he had his other doctor repeat the A1C hemoglobin, which is a measure of where our blood sugar is over a 4-month period, he was surprised to see that it had dropped from 7.5 to 5.7. And this was on a diet directly opposite to the American Diabetes Association. We put him on a high-fat diet, healthy fats that is, and we put him on a very low-carb diet, as well as a number of nutritional supplements, such as correcting his magnesium and zinc, supplying him with CoQ10, the most important transporter of electrons to make energy in our body, and as well as fatty acids, essential fatty acids of the omega-3 variety, which were extremely low. This patient did very, very well, and he's not an exception. If people will come and have these parameters measured, will go on proper nutrients, begin an exercise program, and do all the supplements that we recommend, almost universally, this so-called disease of diabetes will reverse. We say that diabetes is not a disease. As a matter of fact, one of the national experts today, endocrinologist, professor of endocrinology, now doesn't use the term type 2 diabetes, but rather lifestyle diabetes. The gentleman I described is a perfect example of someone who suffers from lifestyle diabetes and who in fact reversed this process to a large degree in only 1 month of treatment.